In this video we will be talking about asthma. So asthma is a chronic inflammatory disease of respiratory system characterized by reversible airflow obstruction characterized by bronchial hyperresponsiveness and bronchial inflammation. Now what are the types of asthma? So it may extrinsic and intrinsic asthma. Extrinsic asthma is mainly called allergic asthma and the patient is allergic to pollen, dust mites, pets, floor dust while intrinsic asthma is non-allergic and its most common cause is viral infections, cold air, gastroesophageal reflux disease, beta blockers, non-steroidal anti-inflammatory drugs. Now what it is the clinical presentation of asthma. So common symptoms include persistent dry cough, shortness of breath, chest tightness, and expiratory wheezes, hyperresonance to lung perfusion. Now diagnosis of asthma. So in patients greater than or equal to 5 years age the person will be asthmatic if the patient have typical clinical feature of asthma. First line tests are pulmonary function tests like spirometry and second line tests include bronchial provocation test by giving methacholine to patient. Now what it is intermittent asthma. So if the patient is experiencing symptoms of bronchoconstriction asthma frequency less than 2 times a week or waking up because of symptoms at night less than or equal to 2 times in month or use of short-acting bronchodilators less than or equal to 2 days per week, and when we perform spirometry on these patients then the forced expiratory volume will be greater or equals to 80%, which is almost normal value. Now coming towards treatment of intermittent asthma. So these patients are treated with short-acting beta-2 agonist drugs like inhaled albuterol 90 micrograms per puff and 2 to 4 puffs as needed. So daily therapy is not required. This is just a rescue inhaler. Whenever patient have difficulty in breathing the patient can use this. In mild persistent asthma symptoms occur greater than 2 times per week and waking up 3 to 4 times per month, and the patient will have forced expiratory volume greater than 80% predicted. Moderate persistent asthma is that in which symptoms appears daily, waking up greater than 1 time per week, and the forced expiratory volume is 60 to 80% in these patients. Severe persistent asthma is that in which symptoms present whole day, patient wake up every night, and forced expiratory volume is less than 60% in these patients. In mild persistent asthma low-dose inhaled corticosteroid like budesonide, fluticasone are recommended. Other drugs like montelukast sodium and zafirlukast and short-acting beta-agonist drugs are used. In moderate persistent asthma daily therapy includes inhaler, which includes low-dose inhaled corticosteroid, and formoterol, which is long-acting beta-adrenergic agonist. Other combination includes long-acting beta-agonist other than formoterol and low-dose inhaled corticosteroid. Other option is inhaled corticosteroid plus long-acting muscarinic antagonists and leukotriene antagonists are also used. Daily therapy includes low-dose corticosteroids like budesonide or fluticasone plus long-acting beta-agonist like formoterol plus long-acting muscarinic antagonists like tiotropium bromide. So this was all about today's topic. For more informative videos, please subscribe to our channel and press the bell button. Thank you.